Hi everyone, welcome back to Forward Therapy. My name is Kelly. I am a certified hand therapist, and today we are going through part 2 of dealing with medial epicondylitis or golfer's elbow. So before you get into this video, if you missed part 1, go ahead and check that out. I'm going to post it in the description bar below. Get through that. You know, that video is kind of the acute phase of treatment, so it's a really good place to start. If you feel like you are doing a little bit better, your pain is getting more under control, and you're coming out of sort of that acute phase of treatment and you're moving into the next steps of what do I do next, this video is for you. Phase 2, this video today is going to focus on restoring flexibility. So we're going to talk about the best things that you can do kind of at this phase of treatment. As always, check with your doctor, make sure that these things are okay for you and safe for you. You can always get a referral to a physical occupational therapist or a hand therapist to find out what's going to be best for your specific case. But let's go ahead and get into the video, and everybody stay tuned. Okay, so the first thing that I think is very important is to continue to avoid those aggravating activities, the things that cause pain. So in phase 1, that is the, first major thing that you need to do is identify what aggravates you and figure out how to limit it, modify it, or avoid it. So that is essentially the element of taking the rock out of the shoe. I always say that phrase, like if you have a rock in your shoe, stretching the foot might help, but if you don't take the rock out, it's still going to hurt, right? So that's the role that avoiding activities that are aggravating plays for this condition. So still super important, avoiding those aggravating activities. You may be able to start getting back into some more physical exercise if you do, weightlifting or some of the sports or recreational activities. Some of those things might be okay. I would still recommend avoiding lifting things with the arms out straight in front of you, being careful with the palm up types of lifts. So again, favoring kind of palm down or neutral lifting patterns, keeping the loads close to you, and again, avoiding the exercises that cause pain. Number 2 thing that I would recommend also at this phase is using a counterforce brace or a tennis elbow band. So even though this is golfer's elbow, you still use the same counterforce brace or tennis elbow band for that. With these bands, right, they're usually a fabric material, and then there's usually a piece of it that has a little bit of a more firm component. That's the part that you want to center on the muscle bellies. So when you go to put this on, again, the pain is on the middle of the elbow, but we're trying to target sort of the meaty part of the forearm, right? Control the muscular element to help disperse the force of activity. So when you slide this on, you want that firmer part to sit kind of centered right over the meaty part of your forearm, right? Kind of that little chunk that you can pull up. And then I usually center it about 3 fingers width down from my elbow crease or from my medial epicondyle, that bone there. And then when you're lifting or when you're doing more activity, you do want this to be pretty snug, fairly snug on the arm, so that it helps to create that counter force or dispersal of forces going through the tendon. These, you do have to be a little careful. There's a nerve that runs right through that area. So if you start to notice a lot of tingling, numbness in your pinky while you're using this, you may have it on too tight. So just be aware of that. But I do think that wearing a counterforce brace, especially while you're doing repetitive activity, lifting, grocery shopping, laundry, like things that, require you to use the arm in a more forceful way, is a helpful component of this phase of care. Number 3 that I would continue to do is use heat and ice as needed, right? I do think that heat in this phase is particularly helpful. 5 to 10 minutes at a time, maybe a little bit before you stretch or you do your exercise session, at least once a day. You can always do more than that if you like. Ice, I think, can be really helpful. Let's say if you've done a repetitive activity, you've gone to the gym, anything where you've done a little bit more effortful work to control that inflammation that comes up from that activity. So heat, I would focus on kind of the muscle bellies, right? The heat is going to bring circulation to that area and blood flow. It's going to help lengthen or soften the muscles that are just getting tight through that area. The ice is going to be helpful at bringing down any acute inflammation that's come up throughout the day. So definitely continue with those heat and ice treatments as you need. Okay, and then the number 4 thing that I would recommend at this phase is, again, we're trying to restore the flexibility. So doing some stretching of those muscle bellies and of stretching of the muscle tendon units that are just they've just gotten so tight, right, with this condition. So it's okay to massage them a little bit first. If you're noticing a lot of forearm muscle tightness, you might find that doing a little bit of some massage or using a lacrosse ball to kind of gently massage that area could be helpful. But stretching at least 3 times a day. You're going to do about 10 repetitions, counting for 10 to 15 seconds on each exercise. So I'm going to demonstrate the exercises that I typically recommend at this phase. If those exercises cause too much pain, if you're feeling pain with them and not just a stretch or tension, this is probably too advanced for you at this phase, and you probably need to stick with the phase 1 exercises. So check that out if needed. But let's get into the stretches. So with this exercise, there's a couple modifications that you can do. You can start with your elbow in at your side, 90-degree angle. You can turn the palm facing up, and then you're using the other hand to gently bend the wrist back, stretch the forearm muscles and the elbow out, the wrist muscles. Hold for 10 seconds, and then bringing it back up. I just want to make a distinction. It's not an active movement and then stretching on top. It's all about relaxing and using the other hand to control. Now, if this feels great to you, you feel like you need a little bit more stretch out of it, go ahead and bring your arm into a straight position, an extended position, and then pull back from here. And again, holding for about 10 seconds. You can repeat that stretch about 5 to 10 times, 3 times a day. And at this phase 2, I also think it's important to work on things like your cardiovascular health, your core strength, making sure that everything proximally and within your trunk is really stable and strong, because if we have strong support, we're going to put less stress down the rest of the arm. I also think it helps to do some postural work, some postural exercises. A lot of times with repetitive activities, we tend to get kind of in this like hunched forward position. Shoulders roll inwards, our back hunches over, the neck sticks out, the chin sticks out. So I think if you can continue to work on keeping yourself proximally in control and in good posture, it will help you really put less stress down the chain. So stretches that I like for that are kind of opening the arms out, the thumbs point behind you, opening your chest out, getting a nice stretch through the front body and the chest. I like doing shoulder blade squeezes, so thinking about sitting up nice and tall, pulling your shoulder blades back, squeezing them together, and relaxing. Maybe even just doing some shoulder rolls, bringing them down and back, just trying to keep everything in that nice upright posture and positioning. So those are typically the things that I would recommend in this phase 2, restoring flexibility phase of treating medial epicondylitis. This phase can last different lengths for different people. Sometimes it goes on for a couple weeks, sometimes it goes on for a few months before you're ready to progress to the next phase of reloading or strengthening the tendon. So I hope this video was helpful for you. If you enjoyed it, please give it a thumbs up. Subscribe to the channel so you never miss another hand therapy video again. And we're coming back at you for part 3 coming soon. Stay tuned for that. See you next time.